Hello, Dr. David Kulla here with Synergy Wellness in New York City. Today we have Mohammed, who has femoral acetabular impingement. We're not going to go too much into that, but what I want to show you is how we adjust a hip. So what I found on him was that his hip does not internally rotate. And part of that has to do with the FAI that he deals with, but it's your left hip that's worse, right? Or do you have, what's that?
I think so, because it wasn't operated on.
Okay, it was?
It was not.
Was not, okay. And this one was?
Yeah.
Correct, okay. So we had an operation on the right hip, not on the left. And what we do here is we want to check the range of motion, and if we turn, this is actual external rotation. It may look like it's internal, but it's external rotation of the hip. And he's going up to where his pocket would be. Maybe he's a few degrees short. That's just stiffness and tightness in his glutes on his part. But when we go to internally rotate, his hip only gets about 5-10 degrees. So we want to get to about 20 to 30 degrees there with internal rotation. So we're going to have him slide down a little bit, and we're going to check his other hip here and straighten that leg out. And this is the one that he had surgery on. Again, it could go another 5-10 degrees up to the pocket, his opposite pocket. That's a good sort of gauge there. And then here, he's very limited, so we want to get another 20 degrees of internal rotation there. So relax that leg. And this is a really gentle adjustment. So it can be done on somebody that's had hip surgery, but not right after hip surgery, obviously. Okay, you would not do this a week, 2 weeks, even a few weeks after hip surgery. He's had his hip surgery years ago, so not a problem here. So what we're going to do is we're going to internally rotate and relax here. Good, and one more. Good. Okay, now drop the leg down. And we're going to check that external rotation. There we go. Now we're able to get a little bit further. And relax yourself here. We're going to do one more adjustment here. Okay. And here we go. We can get about 20, 30 degrees. Probably could use a little bit of stretching there to get another couple of degrees there. So we're going to go ahead and adjust this with some internal rotation as well. Good. And again, this is a hip that he had surgery on. Okay. Good. And there we go. We're able to get that 20 to 30 degrees there. So that's how we adjust or check for an internal or externally rotated hip. If you're flat-footed, most likely your hips are going to be internally rotated. You're not going to be able to get enough external rotation. Did that confuse you? If it did, don't worry about it. As long as your doctor knows what he's doing, you're good. Okay? Thanks for watching.